Hello, my name is Roberto, and I am a student nurse from Seneca. Here's my ID. Now I'm ready to do hand hygiene and going to disinfect my stethoscope. And I am going to wear my gloves. And now I'm going to show you a 360 view of the room. Now I'm ready to see the patient. Hello, my name is Roberto, and I'm a student from Seneca. Can you state your name and your date of birth while I check your wristband, please?
So, William Overton, July 11, 1938.
Okay, thank you. Uh, Now I'm here to conduct a head-to-toe assessment. Is that okay?
Yep.
So for our privacy, I'm going to close the curtain. So, do you feel any discomfort or pain right now? Do you need to go to the washroom?
No.
Okay, so now I'm going to start my head-to-toe assessment with a general survey, with starting with uh, physical appearance. His age, the age of the patient is matches the physical appearance. The skin color of the patient is consistent with the ethnic background, and there's no other unpleasant odor uh, noticed from the patient. Now, for the body structure, can you stand up for me, please? Okay, thank you. Have a seat. Now, for the structure of the patient, the height is proportion with the structure of the body. There is no obvious deformity. The posture is erect, and the position of the body is in respect to the spine is straight, and no noted deformity on the rest of the body. And now for the behavior, the mood of the patient seems to be relaxed. He is able to maintain eye contact. The hygiene is well kept, and um, his facial expression is appropriate to the situation. Now for the work of breathing, he is breathing relaxed, and there's no sign of distress. Now can you state your name and where you are at the moment and the date, please?
William Overton, I'm at the hospital, and today is July 29, 2023.
So the patient is awake and aware, and he is oriented with the place, time, person, and the day. So now I'm going to assess the head, starting with the facial structures. Um, there is no involuntary movement. The skin color is consistent with the body. There is no scars, no lesion, or inflammation noted. Now I'm going to check for the cranial nerve number 7, which is the facial nerve. Can you smile for me, please? Can you lift your eyebrow? Can you frown? Can you close your eyes? Can you puff your cheek? And now I'm going to apply resistance. Can you shut your eyes, and I'm going to open, don't let me open it. Now puff your cheek, and don't let me deflate them. So upon testing the cranial nerve number 7, uh, the patient was able to maintain the position, and was able to resist the applied force. which indicates that the facial nerve is intact. Now I'm going to assess the eyes. The eyelashes is evenly distributed. The eyebrows are present. The I'm going to check the sclera. Can you look up, please? I'm good. I just checked the sclera and the conjunctiva. The sclera is clear and white. The conjunctiva is white with visible fine blood vessels in it. So now I'm going to check the light reaction of the oculomotor. So I'm going to shine light on your eye. Is it okay? So now I'm going to check for the consensual and direct reflex. I am directing light to the left eye, and that is the direct light reflex, and then right eye for the direct light reflex, and for the consensual, whatever side is not exposed to the light, that is what I observe for the consensual light reflex. Now I'm going to test for the accommodation. Can you focus your gaze on the tip of my pen, please? Now on the wall, and now to the tip of the pen, and then I'm going to move close to your eyes. So upon testing for the accommodation, the pupil was able to converge and constrict in response to the distance of the object being shown, and then for the light reflex, consensual and direct, the pupil was able to constrict in response to light. The pupil is 3 millimeter, equal, round, and reactive to light, bilaterally and symmetrical. Now I'm going to check for the ears. In both ears, there is no discoloration noted, no discharge, and the shape of the ear is cone shaped. Now I'm going to assess the nose. The nose, the nares. There's no flaring of the nares. There's no discharge, and there's no lesions. Now I'm going to proceed to assess the mouth and the pharynx. Starting with the inspection, the color of the lips is pinkish red. There's no lesion, there's no asymmetry, and there is no lesions or asymmetry noted on the lips. Now I need you to open your mouth, please, and say ah.
Ah.
I just tested the glossopharyngeal and the vagus nerve. Glossopharyngeal is the cranial nerve number 9, and vagus is cranial nerve number 10. When I asked the patient to say ah, the uvula and the soft palate were rising. Now I'm going to check for the hypoglossal, the cranial number 12. I need you to open your mouth again, please, and stick your tongue, and move side to side, and say light, tight, dynamite.
Light, tight, dynamite.
So upon testing the cranial nerve number 12, there were no tremors noted, which indicates that the cranial nerve number 12 is intact. Now I am going to assess, inspect, and palpate the neck. Do you feel any pain? So upon inspection and palpation of the neck, the skin color of the neck is consistent with the ethnic background, and it is warm to touch. There is no pain or tenderness noted. No lesions. The trachea is in midline, and there is no visible enlargement of the thyroid. Now I'm going to check for the carotid artery one time. Uh, so the carotid artery, the rhythm is regular. It is the strength is grade 2, which is normal and equal in both sides. Now I'm going to test for the cranial nerve number 11, which is the accessory spinal nerve. Can you turn your head to the left? Now to the right. Can you shrug your shoulder, please? Now, can you do it again? But I'm going to apply resistance to the left. Now to the right. Now, can you shrug your shoulder? So upon testing the cranial nerve number 11, the patient was able to perform full range of motion and can, with full resistance, which is an indication that the cranial nerve number 11 is intact. So now I'm going to assess the musculoskeletal, starting with the upper extremity. So can you roll up your sleeves? So upon inspection of the upper extremity, with the muscle bulk of the patient, there is no visible atrophy, no scars, no inflammation or swelling, no masses. And now I'm going to palpate. So upon palpation, the patient skin is moist. It is warm to touch. There is no pulsations or involuntary movement, and there is no tenderness noted or pain. So now I'm going to check for the radial nerve, or radial pulse, I should say. I'm going to do it bilaterally. And I did it for 30 seconds to test for the rate, which is 60 beats per minute. The rhythm is regular, and the strength is 2+, and they are bilateral. Now I'm going to ask you to squeeze my fingers, please. So now I'm testing the grip of the patient. Okay, thank you. So the grip of the patient is strong. And now I'm going to assess the lower extremity, starting with the inspection. There is no visible inflammation, no masses. With regards to varicosities, there is no varicose veins visible. The the hair is evenly distributed and present on his lower extremity, and there's no swelling. Now I'm going to palpate. So upon palpation, the skin is moist, and there's no crepitation. It is warm to touch, and there is no tenderness or edema noted. So now I'm going to assess the thorax of the patient. Can you stand up for me and turn around? And I'm going to roll up your shirt. So upon inspection of the posterior thorax of the patient, there's no asymmetry, there's no scars or lesion, no abnormality on the spine noted, and no masses, and the skin is consistent with the skin, ethnic background of the patient. Now I'm going to do the palpation of the posterior thorax. Uh, do you feel any pain? So can you, now I'm going to test the chest expansion. Can you breathe in for me and breathe out? So upon palpation, the skin of the patient is warm to touch. There's no masses felt, and the chest expansion is equal bilaterally. There's no asymmetry, and there is no tenderness noted. Now I'm going to auscultate the lungs. So if you feel the stethoscope on your skin, can you take a deep breath and then followed by breathing out, breathe in and breathe out. Now inhale, exhale, 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 inhale, exhale. So upon auscultation of the posterior thorax, you can turn around. Thank you. Upon auscultation of the posterior thorax, there is no adventitious sound noted. The only sound I've noticed are bronchovesicular sound, which is an indication that and there is no wheezing and crackling or crackles noted upon auscultation, which is an indication that the airway passages is clear. There is no secretion, or there is no secretion on any of the lobes of the lungs. Now I'm going to do the inspection of the anterior thorax. I'm going to assess the respiration of the patient for 30 seconds. So upon inspection or assessing the respiration of the patient, the respiratory rate is 16 cycles per minute. The rhythm is regular and it is relaxed. The quality is relaxed. And there is no asymmetry noted during inspiration and expiration. Now I'm going to assess the apical heart rate, which is a test for the mitral valve, and it is situated on the mid-clavicular line and on the fifth intercostal space on the left, which is basically the below the nipple line. So I need to expose your chest. Kindly hold it for me. So now I'm going to auscultate the mitral valve. So upon listening to the heartbeat. The heart rate is 75 beats per minute, and it has the quality of regular, and there is no adventitious sound noted, no S3 or S4. So now I'm going to do the assessment of the abdomen. Can you go to the bed, please? So I need to roll your shirt up. So now I'm going to inspect the abdomen. The contour of the abdomen is flat. There is no visible pulsation. The umbilicus is in midline and it inverted, and the skin color is consistent with the rest of the body. Now I'm going to auscultate, starting with the right lower quadrant, the right upper quadrant, left upper quadrant, and the left lower quadrant. Upon auscultation, bowel sound is audible, which is high pitch, and gurgling sound, which is an indication that there is audible normal functioning in the abdomen. Now I am going to palpate the abdomen with 1 centimeter depth, which is superficial, starting with the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And upon palpation, there is no masses, no rigidity, no muscle guarding, and no muscle pain was noted on the patient. So that concludes my head to toe assessment. Thank you very much.